In today's video, we're going to talk about what Hashimoto's is, how that's different than hypothyroidism, and why so many doctors ignore it. Hi, I'm Dr. Jesse Morris. I specialize in natural solutions for fatigue, gut health, and autoimmunity. So let's talk Hashimoto's. First off, what is it? Okay, at the most basic level, Hashimoto's is an autoimmune disease where your immune system attacks and destroys the thyroid gland. But how is that different than hypothyroidism? Okay, by definition, hypothyroidism is a condition where your thyroid gland fails to make adequate amounts of thyroid hormones. Now, there are a number of different conditions that can cause hypothyroidism, and Hashimoto's is one of the main ones. In fact, here in the US, 90% of hypothyroidism is caused by Hashimoto's, right? 90% of low thyroid function is caused by an autoimmune attack on the thyroid gland. So if 90% of hypothyroidism is caused by Hashimoto's, why do so many doctors ignore it? Well, I'll tell you. The standard of care in Western medicine in terms of treating hypothyroidism is to measure thyroid hormone levels on a blood test and then give thyroid medication to bring the levels back into the normal range. The problem with that model is that it doesn't do anything to address the underlying autoimmune attack. And when autoimmune conditions are left untreated, they tend to get worse over time, and they can actually expand into different tissues. Now, honestly, I'm not sure why conventional doctors don't treat Hashimoto's or don't do much to treat Hashimoto's. It may be that treating an autoimmune condition is just more involved than prescribing a medication, right? Really effectively keeping your immune system in check requires changing your diet, taking supplements, managing stress, right? In other words, it's not a quick fix. And it may be one of these examples where Western medicine tends to focus more on treating symptoms than addressing the underlying cause of a condition. So for people with Hashimoto's that's progressed to hypothyroidism, they very well may need to take thyroid medication. But I also think it's really important to address the autoimmune part of it, because the inflammation and the cytokines and the antibodies from an autoimmune condition can cause a whole bunch of other problems beyond just lowering thyroid hormone levels, okay? And if you can catch Hashimoto's before it progresses into full-blown hypothyroidism, you can be proactive to keep it in check and actually keep it from progressing. So in my next few videos, I'm going to be teaching you what thyroid tests you need to get done to fully evaluate the thyroid, and we're going to look at some diet and lifestyle strategies to manage Hashimoto's. So if you want more information about Hashimoto's and hypothyroidism, stay tuned for those videos. Or if you know you want some one-on-one help managing Hashimoto's, you can request an appointment through drjessemorris.com. I'm happy to help. Thanks for taking a few minutes to watch this video, and I look forward to seeing you soon.